Good afternoon. My name is Karen Sampson-Hoffman, and I'd like to welcome you to today's Ask the Expert webcast, ADHD in Military Families, Resources for Service Members. Today we are welcoming Heather Hebdon, founder and director of Specialized Training for Military Parents, also known as STOMP. Ask the Expert is a twice-monthly series presented by the National Resource Center on ADHD, which gives the general public access to top clinicians, researchers, and other professionals. The National Resource Center is a partnership between CHAD and the Centers for Disease Control and Prevention and serves as the national clearinghouse for the latest evidence-based information on ADHD. During May, CHAD is offering a special Ask the Expert membership. You can save 25% if you are joining or rejoining CHAD by using the promo code MAYA14. If you are currently up for renewal, please call CHAD directly at 1-800-233-4050 and ask for the membership department in order to receive this discount. This is a limited time offer and will expire on Saturday, May 31st, so act now to receive this discount. It is a privilege to introduce today's guest, Heather Hebdon, founder and director of Specialized Training for Military Parents. STOMP is a federally funded parent training and information center established to assist military families who have children with special education or health needs and is funded through a grant from the U.S. Department of Education. Ms. Hebdon began STOMP in response to the needs of military families, including her own, who struggled to find appropriate resources for their children with special needs. For those of you who would like to ask Ms. Hebdon a question following her presentation, written questions can be submitted in the questions box on your GoToWebinar toolbar, as indicated in the red arrow shown in this slide. All of our questions are moderated, and we will try to get to as many as possible during the question and answer portion of the webinar. A recording of this webinar will be available at helpforadhd.org in about 2 business days. To view the recording more quickly, the same link you used to access today's webcast can be used to access the recording 30 minutes after today's presentation. Finally, following today's webinar, a brief survey will appear on your screen. Please take a couple of minutes to let us know what you think and how we can better serve the ADHD community through the Ask the Expert webinar series. Again, we are very pleased to welcome today's expert, STOMP founder and director Heather Hebdon. Ms. Hebdon, if you would like to begin.
Thank you. I appreciate the opportunity of visiting with all of you and participating in this Ask the Expert. That sounds very ominous. Ask the Expert series. My role today is going to be talking about the military dimension of looking at services for individuals who have disabilities, especially those who may have attention deficit hyperactivity disorder or something similar. And if you'd like to move on, we'll keep going here. I'll tell you a little bit about STOMP and what happened. STOMP is a program of PAVE, which is a statewide organization here in Washington State, but STOMP is the only national military organization specifically designed and established to work with military families who have children with disabilities. We established the grant in 1985 and have been working with over 1 million families since that time. All of our staff, including myself, are the parents of children with exceptionalities, and all of us have lived the military system. And so we've learned about the challenges firsthand that our families can face in getting information, resources, and support. Next slide. We have 4 regional offices. Our headquarters, of course, is here in Washington State. We have an office in Colorado Springs, one in Arizona in Sierra Vista, and one in North Carolina in Fayetteville. These offices are set up for the purpose of giving information to families and professionals within regions so that they can call and not have to worry about long-distance charges or crazy hours. We do have a 1-800 number that anyone can call. It's 1-800-5-PARENT. And then we can connect you with any of our coordinators. Next slide. So today I wanted to talk a little bit about some of the complexities that we see when we have a family member with special needs and we are military affiliated. In order to do that, though, I really have to talk about some of the complexities that we as families have in general. I have 3 children. All 3 of my children were in the Exceptional Family Member Program. All 3 of my children have exceptionalities for different reasons. My oldest son, Ian, has Down syndrome. My daughter had severe asthma that had hospitalized her 3 times before she was the age of 2. And then my youngest son, Eric, has attention deficit hyperactivity disorder. And when I say hyper, it really is true. Eric is one of these individuals where if his mouth isn't moving, his body has to be. And even now as an adult, he is very fortunate that he is in a job that he loves that keeps him moving. So we see those issues as families that are a dynamic for all of us. We all have the complexities of education and specialized medical supports and looking at our home life and just in general trying to keep ourselves sane, as well as looking at what are those resources within the community that will help our family members or help us for that matter. Okay, next slide. What I want to point out, though, is that there's another dimension that can fall on top of this for our military families. While we still have the education and the medical and the home life and the community resources, the military dimension can take that and move it from something that we think we're learning about to something that is so totally alien every time we move. Next slide, please. Let's take an example here of what we're thinking about every day. I have a child. My child has difficulties in school. I have teachers and administrators who I have worked with for the last 10 years because my kids have all gone through the school, let's say. And so when my child has these difficulties, they know a little bit about me. They know about the way I handle things, and they also know that I'm a collaborator with them wherever possible, but that I am also, first and foremost, the child's parent. Now, let's take the same kind of a scenario, but I've only been in the place for 6 months, and my child's having meltdowns and having difficulties staying in class and is being very disruptive. And I don't have the relationships that I might have if I had been in a community longer. And that can be a challenge. That can cause some difficulties in how I respond to problems, as well as how those in the educational system or the medical system might respond to me. Okay, next slide, please. So let's look at the military, or military medical, for instance. A lot of people think that we have, quote, unquote, free medical. That's not true. It isn't an insurance program. It isn't free medical. It is an entitlement program. And what that means is that with TRICARE, anything that we get, Congress is the one that decides what resources we will have. So they have identified a system. You have your military treatment facilities. Many of our families are able to be served there. All of our active duty military personnel are considered TRICARE Prime, and that means that they will receive their services through the military treatment facilities or the medical treatment facilities, first and foremost. And then you have different options that the family can use. Some of those are at no greater cost to them because it is an entitlement. Others, if they choose to go to an outside provider, they would pay a percentage just like any insurance policy. But since they aren't insurance, they would have the expectation of knowing that what they had, Congress had agreed to. They can't change it, and they can't say, okay, that's not fair because I want to do this now. And so the military makes the decision, or sorry, not the military, the Congress makes the decisions on what types of services there are and how you get those services each time. Okay, let's go to the next slide, please. Then we look at benefits and government benefits. We have kind of an interesting situation in that we'll find some of our military families who are lower ranking, E4 and below with 2, 3 children, who will qualify in one place for supplemental security income for their child with special needs, including children who you might think wouldn't because of the type of identified disability. But we have actually seen children with ADHD receive SSI because of the significance of the impact of the ADHD on the child's daily living activities. But then they PCS, or permanent change of station, meaning they move to another duty station. And they have to once again go through the process to make sure they are eligible for that same service in the new location. It's important for all of us to prepare and inform families on the benefits and how that may change from place to place. If they're receiving SSI and they're overseas and the person turns 18, they will no longer be eligible for SSI until such time as they have moved back to the state and have set up residence in a state. And so that's a difference than what families might understand, because many families who are civilian, they won't qualify for SSI until their child turns 18. The month their child turns 18, they apply for SSI. The individual gets SSI because of their needs. With our military child, they can get SSI overseas if they are there with their parent on military orders. But the day they turn 18 or the month they turn 18, that is no longer considered an option for them, even if they are still a dependent of that military member overseas. They cannot have SSI until such time as they have gone back to the state and have set up residency and then applied. It's a little confusing for families at times. It can be challenging to say, okay, when do I apply? How do I apply? What am I qualified for? And will I continue to be qualified for it? Next slide, please. So let's think for a minute. There are things that TRICARE will provide. Durable medical equipment is one of them. Therapies, such as applied behavioral analysis. But there are things that they will not provide, and those typically can be covered through Medicaid waivers, home and community support waivers. And so what we want is, as families, to make sure we are accessing all of the resources that may be available to us. We have a challenge, however, because with our military families, they may be eligible, say, in Washington State for a waiver because of the needs of the family member and the intensity of those needs. And so they get it in Washington State, but then they move to Arizona, and there's a waiting list. And they have to go to the bottom of that waiting list, even though they still have the same need that they had before. But because of where they now live, they will go to the bottom and they'll have to work their way up. Typically, that will happen over and over again, at least 6 to 8 times, and the family member many times will not get those additional supports and services because of the waiting list. Next slide, please. So here's a couple of quotes that came from families. We did a survey in 2013 about the challenges our military families were facing when it came to accessing Medicaid and Medicaid waivers and other federal benefits that they would have better access to if they were stabilized. And this parent said, we move every 2 years. Most services, such as PTOT, applied behavioral analysis, etc., all have a minimum of 6 months waiting list. By the time we are accepted and start services, it's time to move and start from scratch again. Whatever progress we make is lost. Another parent, on the next slide, stated, our newly retired family desperately needs echo coverage until my son is off the long waiver list. It will be at least 11 years, and my child will be an adult before we receive services. We have no respite and may become financially ruined before my son reaches the end if we have to wait. That happens because there is this need for support, and yet because we haven't lived in a place, we have to start at the bottom of the list and work our way through, just like any other parent who starts. However, because we're not stable until we retire, a lot of times where other families would be much further up the waiting list or already be receiving services, these families will not. Next slide, please. So then we look at the educational dimension for military life. All children who have specialized needs, whether they be of the nature that they are in need of specially designed instruction, such as those that are provided under an IEP, or they need accommodations or modifications, such as those provided under a 504 plan, are kids who have some additional benefits above children who have none. What happens is when a military family PCSs and they have a 504 plan or they have an IEP, they're going to take that document and any supporting information such as evaluations with them, hopefully. They're not going to pack it in their whole baggage, they're going to hand carry it. But we have families where that doesn't turn out to be the case. And they have 3 totally different systems in which they can be learning. The first one is like all of our families, military or not. It's those schools that are run by, that are required to comply with federal Department of Ed rules, whether it's Section 504 of the Rehabilitation Act or the IDEA Part B or Part C, so birth to 3 or 3 to 21 services. And those schools are all over the United States. The U.S. Department of Education has monitoring requirements that every state must do to assure that those schools within their state are meeting those federal obligations. And then the schools report to the state on data such as discipline, etc., that is happening within that school. And the state has to then report to the Department of Ed. with our military families, they have the ability to be in schools like that depending on where they live. If they are stationed overseas, however, the U.S. Department of Education regulations do not apply. Only the Department of Defense regulations regarding special education and related services apply. These regulations came into effect later than the IDEA, and so they have to write their own regulations to implement the Act, the Individuals with Disabilities Education Act. And so they have their own set of guidelines or DOD instructions regarding services in those overseas schools. They also have rules regarding birth to 3 services in the overseas systems. When a family is here in the United States, they may also have a DOD school that they go to, but these are called the Defense Dependent Elementary and Secondary Systems. They are both run by the Department of Defense Education Activity, whether you're overseas in a DOD school or in the United States in a DDES school. And they have their set of regulations, as I said, that implement services. However, if you are in the United States and you are at an installation where there is a DDES school, the only children that can be eligible and receive services in that DDES school are those who actually live on the installation. If they live off the installation, they have Department of Ed schools. If they live on the installation, they have Department of Defense schools. And it can be very confusing and frustrating for families. So this dimension of 3 different systems and working within those systems and looking at where they get services or where to get supports can be a challenge for our families. And so we want to make sure that they are aware that, yes, you may have a child who has ADHD and who receives services under an IEP in Texas. You want to carry that IEP and the reports and the evaluation with you if you PCS to Kentucky. But if you are in a DDES school in Kentucky, they're going to have to do their own evaluation. They're going to utilize the IEP that you come with while they do an evaluation, but you have to meet the criteria for eligibility in that DDES school in order to continue to get an IEP. If you do not meet that criteria, then you will have the equivalent of what is a 504 plan. However, both in the DDES and the DOD schools, they don't comply with 504. They have to, under a proclamation that was signed by the president, provide accommodation services. And so they do an accommodation plan. And that is the closest to a 504 that you will find. And it really is important for families to know what it means, that in reality it should have the same kinds of accommodations or modifications that you would see on a 504 plan if you were in a Department of Ed school anywhere in the United States. Have I now made it clear as mud? Probably. And that's how it feels for our families. The thing that's important to understand, 3 systems. Those 3 systems can either work collaboratively or they can be very disjointed. They can be those systems overseas And when a family comes back, they could be in a DDES or a DOD system. The DDES systems are primarily in the southern United States. Families need to know where they are, and they need to know what to ask for. Next slide, please. The reason is that they will move an average of 9 times through that child's educational career. Now let's think about that for a minute for our kids with attention deficit hyperactivity disorder. Disruptions and changes can be very challenging in and of itself. But then when you're having to reestablish services, reobtain comparable services to what you had had before, or even know what to ask for, or if the term that you're using is the same, it can be even more disruptive for our child with ADHD or with learning disabilities or with other types of disabilities, behavioral or whatever. And so the family is trying to address these 3 struggles each time they move to a new duty station. And so the goal is to give them enough knowledge ahead of time that those barriers are not there impacting as much as they might be. Next slide, please. So one of the things that has been done to help with this is what is known as the Interstate Compact or Military Interstate Compact. This is a compact that is signed by the governors of each state. And through the compact, they try to alleviate some of the difficulties that I've just identified. They assure that whenever possible, if a governor has agreed that their state will be a part of the compact, that certain protections or rights will be there for military children. The Interstate Compact addresses not only the rights of children with specialized needs, but all military children. So, for instance, Washington State just passed a law about the number of credits a child must have in order to graduate, and it has increased to 24 credits. If you had a child who was in the 12th grade coming to Washington State who had been on a track of 18 credits, all of a sudden they would have to have another 6 credits that they may not be able to attain without having a delayed graduation. But since Washington State is part of the Interstate Compact, they would look at the credits the student has and match those up with the credits that would be expected. And they may find that, for instance, the child has been doing history, Kentucky State history. Well, that history credit is going to count as a history credit in Washington State, even though they haven't passed the Washington State history exam. And so it will be added on. And by matching up these credits, it can alleviate a child for graduation credits, and therefore they can graduate on time. The compact also allows for delayed enrollment because a child has PCS, the family is PCSed in the middle of a break, and so they can enroll when they arrive without having been penalized for a delayed enrollment or a late enrollment. They can, it helps to assure that kids who are military will have the opportunity to try for things such as sports, being eligible to apply for and participate in sports, even though they may have arrived after the timeline that you would typically have for recruiting of those sports. They could send a video that shows what they do and how they are competing so that they have the opportunity to try out. They may also have situations where they have been in a gifted or talented program and they PCS, but the school says, well, we only allow kids to enter into the gifted and talented program if they are here at this time. We only take the testing at this time. If the governor has signed that they will participate in the interstate compact, they have to find an opportunity for that child to test and see if they are eligible for those gifted or talented classes, even if they would say they were typically closed for all other students. For the student with a military background, the compact helps to increase their potential for being able to be involved where they might not have been otherwise. Next slide, please. So with the Interstate Compact, it has specific language in Article 5, which talks about placement and attendance for special education services. And it says that they will receive those services that they had before initially until such time as they have been able to look at the needs of the child. And then based on that, they will subsequently perform an evaluation and determine what are the appropriate placement or services for the child. It's not going to give anything above what the requirements in the IDEA are, nor is it going to assure exactly the same kind of program. But through the Interstate Compact, it reinforces that, yes, you have to provide services, and yes, you have to do an evaluation. You can't just say the child does or doesn't qualify until you have given the child the evaluation and you have looked at the criteria. The other thing that it does not do is it does not assure protections for children birth to 3. It does for children 3 through 21, but it does not address services for children birth to 3. And the reason for that is that it is talking about educational services K through 12. And while it looks at the transition as part of that K through 12 services, it does not look at birth to 3 as part of the K through 12 because it isn't. So that's another one of the challenges that our families have, even with the Interstate Compact and the rights that have been identified through the IDEA. Next slide, please. So then let's look at home life. The challenges our families have include the fact that there are many times that their family will be in a situation where they are separated from their peers. They have situations where their military member may have lengthy assignments where they would not know that the child may have the ability to talk to them. There may be situations where they will look at overseas assignments at bases where the family has to learn a new language or live in a different culture than they might typically. And that can be challenging. There can be situations where there are unaccompanied tours, and that those unaccompanied tours will cause the family to have to be separated and not know what's going on as typically. And it can be a year, it can be 6 months, or unaccompanied tours could be longer. My husband was in one where he was gone for 2 years, and we weren't able to follow because they did not have the services for our son. And so you have to look at those things. Those overseas assignments can mean a totally different system for our kids. It can mean that they don't have the resources, and therefore, while the military member would go over there, the family would not. There is also situations such as unemployment that the spouse may have because of these continual moves. And so those dimensions of home life can change from place to place and can make for some undue stress that we might not think about, but that can be very, very difficult for the family. We have had situations, of course, with the war that has gone on that have caused families to lose the military member and to then have to go on without that military member, or where the military member may be assigned to an area that the family cannot make quick contact because of the types and level of secrecy that has to be associated with that assignment. And those can cause stress. But the strong thing about military families, and I always say this, while we may have all of those challenges, the military families are truly very resilient families and have amazing coping strategies because of their community. Most typically, military families will find themselves in a community that is military-based. So it may be on the installation or it may be in a surrounding area, but a large number of those families within that system are military. And so there's a network that becomes a part of that military home life to support the families during deployments, etc. Next slide, please. So let's talk about the child for a minute. I'll give you some ideas. There are approximately 2 million military children who've experienced a parental deployment since the year 2001. That's quite a lot of children that have had to go through that. In addition, you're going to find that there's 1.2 million military children who are dependents of active duty military personnel throughout the world. So when you look at 2 million children total since 2001 that have faced deployment, and at this very time there are 1.2 million military children. So that means the snapshot in time for now is 1.2 million. There are expectations that a good percentage of those, at least 120,000, will have a family member with special needs. That's looking at the 10% margin that you might think of in our general public. However, we know that that those numbers are low, and that there may be even more military children or military families who have family members with special needs. We also know that while we have these estimates, we know there are nearly 80% of our children who will attend public schools throughout the United States, but the other 20% will be in overseas or in DDEF schools. And when we look at that 80%, we're also looking at those who are homeschooled, because there are a percentage of our military kids who are homeschooled. And we also know by the data that has been accumulated and shared through the Government Affairs Office that our military families will move 3 times more often than their civilian counterparts. So there are some interesting dynamics that come into play with all of our families. But when you put those layers for a military family, the dimension becomes more expanded. Next slide, please. So let's talk a little bit about what are some of the systems or resources that a family might be able to utilize. Next slide. We have the EFMP program, or the Exceptional Family Member Program. EFMP is a mandatory program for all branches of the service, but there are also support systems within them, depending on which branch you are involved with. The family support can include respite in some situations. It certainly includes advocacy and training, and it can include a parent-to-parent type of support. It will assure that the family member's medical needs can be met wherever the military member is sent, or they will deny command sponsorship of that family member to assure that they are not placed in a situation where they could be endangered because of the lack of medical services. Next slide, please. As I said, it's a mandatory program, and that means that the military member can be held in contempt if they do not enroll their family members with specialized needs. It also means that while it is a mandatory program, it is not the military's responsibility, but the military member's responsibility to assure that that enrollment is always kept current. And therefore, they need to update that enrollment at least every 3 years, or if there is a change in the needs of the individual with a disability. Next slide, please. Then we have our school liaison officers. Now, in some branches of the service, like the Air Force or the Navy, the SLO may be taking on the role of not only the school liaison, but also the Exceptional Family Member Program support systems. The school liaison serves as a primary point of contact for families if there are difficulties. and they have in their required activities the responsibility of reporting issues to the command when they see difficulties that come into play for our military families. 26% of the families who are working with the school liaison officers, or what are referred to frequently as SLOs, have children with special education needs, and up to 82% of a SLO's time can be dedicated to working with families with specialized needs. We also find that they have responsibility for forging some of those relationships between the installation and the community. The school liaison officer will be the person who will set up partnerships that can include activities, resource fairs, community drives. One of the things that one of the school liaison officers has done in some of our states, or one of our states, was a joint effort with their local school to do a drive for school supplies and clothing for children who were in need, and they called it their Fill the Bus support, community support system. And so they had a school bus, and people could bring supplies or coats or clothing for children who were from 3 to 21. And it was a way of supporting the community, and it was one of the things that the school liaison of that particular community had helped to establish. Next slide, please. So we also have the Child Youth Services, and this is done through morale, welfare, and recreation systems. And because it is an MWR system, it is to be open to all qualified children, ages birth through 21. And it can include such services as daycare for our children birth to 3 or birth to 5 or birth to 12. They also have recreational programs and before and after school programs. The challenge that we have is that because there are children with special needs, they have to establish an accommodation plan, and that means that they are required to set up inclusion action teams or multidisciplinary teams that will look at the needs of a child to assure that what they have available within the Child Youth Services can meet the needs of that child, and that they can provide appropriate accommodations. And so as they work through that, that will be done through your DOD or your Army Community Services or your Airman Family Readiness Center. There are a lot of different places where it will begin, but each time a child has unique needs, that child's individual needs should be considered with regards to the services that they provide. Next slide, please. With the Child Youth Services, they've made very clear in their DOD instruction that it is the policy of the Department of Defense to accommodate children with special needs unless those accommodations fundamentally alter the nature of the program. Now, if you have to add one more person to the mix, that really isn't a fundamental change in the nature of the program. However, if you had to say, well, we can't do a swim program because the child with specialized needs has a wheelchair and we don't have a wheelchair lift for the swimming pool, so we won't be able to do swimming for that child, that would be an altering of the nature of that program. And so they could look at trying to meet the needs of the child in another setting. Next slide, please. There are some weaknesses that the Department of Defense has recognized that need to be addressed. These were done based on a government Affairs Office study in 2013, and included such things as the fact that there's not a standard definition of special needs within the Department of Defense systems. And when they talk about fundamentally altering a program, they need to think of things that that might impose an undue burden. And these can't be simple, low-cost things, such as making the facility accessible. But if there would be a danger or a direct threat to the health and safety of the child or others, then they need to define that more clearly. And that's one of the things the GAO addressed. There needs to be data kept, and right now there's no real clear data on what accommodations have been provided to children. And you also need to know that the GAO study said that services use a variety of methods to inform parents about their assessment process, and that is inconsistent because it makes it difficult for families to know what the process is based on what they have experienced before. If you have a Navy family who is, say, on Joint Base Lewis McChord, they're going to go through a process within the system called SNAP, or Special Needs Accommodation Process, that is pretty much run by the Army regulations. But they may not have the same system if they were to go to Pendleton or to one of the Marine Corps bases. And so that's been a challenge that they have noted in the GAO study. Next slide, please. There are great programs such as Kids Included Together. This is a nonprofit out of California that has been contracted with by the Navy and have done some really wonderful training to help keep our kids included and get them into the child youth services. It's very exciting things that they're doing. And I'm very pleased to see the collaboration that they have with the military to work on those child youth services. They have some very creative accommodation strategies that have been established, and they really can make a difference in how to look at including children with special needs. Next slide, please. So one of the things that we had tried to identify through our survey and through other surveys that have been done were the need of our military families and what they seem to be. And the reality is that there have come again and again 6 typical needs that come up. First one is continuity of care. If there isn't any way of knowing what's happening and looking at care being the same without regard to geographic location, it makes it very challenging for families. While we know that at this time the continuity of care can only go so far in as much as we talk with the medical people and the educational people and the community resources to find ways of assuring that we have a system in place that will work for the majority of children. That also means that you have to have policies that have some continuity to them from place to place. And so that is a challenge that still gets in the way of helping families. Community supports, they're out there, but families don't always know about them and how to access them and even what to call them. And so helping families to learn more about those supports is critical. The care providers within the military system sometimes don't have all the knowledge about working with kids with special needs that we would like to have them have. And, you know, the lack of knowledge usually is what causes fear in doing some of the supports or services that we know our kids would benefit from. And so looking at how can we assure that there are care providers who have the knowledge about special needs and also who have an understanding of our unique military culture, because it is a culture, it is a community, and sometimes people forget that the reasoning behind what we do as a military system is because of the way it is established to assure that our military members are able to leave on a minute's notice and meet the needs that are out there to assure that our country and all of our families within our country have the rights and protections that were given to them through the Constitution. The military members are the ones who stand up to assure we continue to have our freedoms. But that does mean that there is a culture, that there are sometimes things that have to happen that we don't typically see happen in a community outside of the military, and yet that we want families to be more aware of. So these different needs, as families, we can help other families to find. There are lots of things that can be done, and there are lots of things out there to support or sustain our military families. Next slide. The list here of resources are ones that I think are some of the best. Of course, you've got your DODEA schools. You also have your Kids Included Together, Military Homefront, Military Interstate Compact. All of these are things that we have talked about. And we're always, as an organization, through STOMP, willing and happy to answer questions or to work with families. So I hope that this has been useful, and I hope that you have appreciated it, and I'm hoping that we have some time for questions.
We have time for questions. For our audience, we're going to extend today's presentation just by a little bit so we can get to some of our questions that we've received. And our first question is a very simple one. Irene asks, what do the letters PCS stand for? Now, you've used this abbreviation several times. So this is a very brief question to kick us off.
That's an easy one, and I apologize for having used abbreviations. PCS stands for Permanent Change of Station, and that is the military's way of saying a move.
And on the heels of the idea of a move, we have a question now from Shane, whose family is looking at a move. And his child has an IEP, and he was wondering, they're moving overseas. Will his child be able to continue that IEP at his new school? Will it be recognized there?
Okay, very good question. The answer is yes. You need to take that IEP, make sure it's your current IEP, and I always suggest you take at least the last evaluation that was done. The system, the military system, will look when you're going to be going overseas. You have to go through screening, EFMP screening. And when you go through the EFMP screening, they're going to want to look at both the medical needs of the child and the educational needs of the child. They cannot deny you an overseas assignment based on the lack of educational services, because the DODEA schools are required to provide a free, appropriate public education consistent with the IEP. They can, however, deny access to overseas assignments based on the lack of medical services. And so you need to make sure you have all of your data current and that it reflects exactly what the needs of the family member are. If you can go over there and you have that IEP, don't expect that the school's going to have a lot of prior notice that you're coming. Even though the IEP is looked at by a screening committee, they make a recommendation, and then assignments will determine whether or not a family will go overseas or where they will be stationed exactly. And so the IEP may never have been seen by the Department of Defense Dependent School until you get there. So don't be surprised by that. But they should immediately implement that IEP to the best of their ability while they do the evaluations to determine if your child still needs services or meets criteria for their area.
Thank you. Denise has a question following on that. She was wondering, are DOD schools subject to the same laws, IDEA and 504, as the public schools are in the United States? So do they have to respond to IDEA?
Okay. The long and short answer is they have to comply with the Act, that which is passed by Congress. However, they do not have to comply with, nor will they comply with, the regulations that have been written by the U.S. Department of Education or by any state. They have their own instruction. It is called DODI 1342.12 and 1342.21. This addresses the special education services. They only have, since 2006, had to comply with 504 plans. And they are not called 504 plans. They are called accommodation plans in a DOD school. And the reason for that, it's kind of an interesting little dilemma. When Congress passed Section 504 of the Rehabilitation Act, it talked about it having to be implemented within the United States and her territories. When you go overseas, you are not, even though you're on a military installation, an Army installation, a Navy installation, whatever it might be, you are in a host country. And therefore, 504 cannot be utilized over there. because of that, in 2006, there was a presidential proclamation made that required the Department of Defense systems to establish a comparable service to that which was available to families under Section 504 of the Rehabilitation Act. And so they now have their accommodation process, and it's very similar to 504.
Thank you. We have a question now from Mary Ellen, and she says that her family is going to Germany, and her daughter will be attending a DoD school. Her daughter has ADHD along with a sensory integration disorder. She was wondering, how does she initiate the process to get her daughter some individualized help in school? Now, this is many families that I'm aware of begin their military careers in Germany. And so how does a parent go about getting some assistance there?
All right. If she hasn't gotten an IEP, when she goes over there, then she'll immediately want to make sure that they're aware of her daughter's ADHD and sensory integration issues, and request in writing an evaluation. If she has an IEP, then she wants to request an opportunity to sit down with the teacher and, whether it's the OT or the speech therapist or whomever that will be addressing some of those sensory issues, she'll want to sit with them and talk about, these are the things that we have found that have worked well, these are the things that don't work well. My grandson has significant ADHD. He also is on the spectrum for autism, but very high. He has Asperger's kind of situation. But noises and certain situations where he feels very cramped or closed in will cause him to have some real sensory overload, and he becomes very agitated. So being aware of that, we have had to change some of his services and programs to make it work for him. Good example, my grandson loves to play the trumpet. Now, him playing the trumpet by himself, he doesn't seem to have an issue. But when he was in a band room with all the other noises, he was having a lot of difficulty. And then we found that it was because we took him straight from lunch, where there was all the noise in the cafeteria, right into his band class, where there were other kinds of noises, and it became he was overstimulated, and therefore he acted out, and he had difficulties being able to attend. We had to change that because it wasn't fair to him or any other student in that program for him to be having the difficulties he had. So talking with the staff, making sure you have as much data as possible, and making sure that people know that you're there to work with them to help your child.
Thank you. Well, when you're talking about looking for people to help parents to help their children, Tammy has a question. Are there advocates available for parents of children in DoD schools? If so, how do we find one? So she's looking for an advocate to go to a DoD school with her and try to work out the situation to help her child.
Okay. Through STOMP, we have a network of volunteers. We do have some who are overseas in certain locations. They are families who have gone through specialized training, families and its family professional teams that have gone through specialized training. And they're able to help if you're in their general vicinity. We have not got the number of advocates that I would like to see us have overseas, because it is kind of a difficult system for people to figure out how to do that in. I do know that if families, for instance, I've attended IEP meetings in DOD schools via telephone or teleconference so that the family had somebody there, and I know that other members of my staff have also done that. And so that's an option that we can provide to families in some situations, and we try to make that as accessible to them as possible.
All right. Well, you mentioned finding resources, and many times at the National Resource Center on ADHD, we do get phone calls from families looking for advocates and for assistance in going and meeting with the education team. And your program is one of the ones that we do refer people to for military families. And as you said earlier, you have locations. You have 4 locations in the United States that people can contact?
Mm-hmm. We do, and we also, on our website, if they want to go to www.stompproject.org, we have our volunteers as well listed there, and they can check out to see if there are volunteers in their area. If they don't see one, there are ways that we can help them no matter what. We also are part of a network of PTIs throughout the United States, and so we sometimes will work with the PTI in a state so that they can be an effective support for a family as well.
All right. Well, we have a question now from Mildred, and she was wondering if you could provide or recommend a list of things a military family can carry or should do to ensure that their child gets the support they need in a DOD school. So is there a checklist, perhaps one that is available through STOMP?
Actually, there are checklists. It's on our website. If you want to go to PCS, there's a packet on PCS moves and things to consider. I also strongly recommend to anybody who is getting ready to do a PCS move to go to Military Homefront and go to the Special Needs section of Military Homefront. They have what is called the SCORE, and that stands for Special Care Organizational Records, and it's a tool that we were very thrilled to be a part of being able to talk about, that has been established that families can get for free. They can get it online. They can get hard copies. It's a wonderful document to help them put their records into order so that they can take them with them when they go someplace. Also on Military Homefront, they have a new program that I don't think a lot of people have taken as much advantage of as they could. It's called Plan My Move. And what the family can do is identify where they're going, when they're going to go there. It'll ask, do you have a child with special needs? And if you say yes, then as you're going through, it has different things that you might want to consider to do at different times. So it's kind of a calendar of events that you may want to make sure you are doing in preparation for your move. And it's a really nice tool. Isabel Hodge, who is a parent herself, and works out of the Special Needs Office in the Pentagon, was very instrumental in making that thing come to life. And definitely a resource.
You have given our attendees, our participants, a lot of resources today, and I think this has been an exceptionally useful Ask the Expert session for our participants, and the National Resource Center on ADHD is very pleased to be able to host you today and have you today. This has been a very good presentation, and I would like to thank you, Ms. Hebdon, for being with us today and for all of your thoughtful answers. And for our attendees, our next Ask the Expert session is coming up next week, and we would invite you to join us. We will be welcoming Dr. Anna Bromowitz, who will discuss parenting skills for the summer vacation months. Join us to learn more about how to help manage your child's ADHD systems during the summer when routines are the most flexible. You can register now at helpforadhd.org. This has been a presentation of the National Resource Center on ADHD. Ms. Hebdon, thank you for joining us. Our participants, we were very pleased to have you, and we hope that you will be able to join us again next week and for future presentations. Thank you very much, and have a good day.